Hi everyone, I'm Bill Riley, and on behalf of all of us, I'd like to welcome you to our broadcast today, Enhancing the Patient and Provider Experience with Virtual Documentation. Together with our friends from Augmedix, we're going to talk about an area where I think so many providers welcome help. In my mind, this is really about changing the game with respect to improving and streamlining the documentation, the documenting of patient visits in the EHR. Before we get going, a couple of housekeeping things quickly. We've got all the phone lines muted currently. However, we are going to pause for questions a little bit later in the broadcast, so please use the little chat bubble in your GoToWebinar control panel. As you think of questions, please submit them. We will get to as many as we can, and for those that we can't get to, I promise we'll follow up after with a response. Okay, so it's my pleasure to introduce our panelists, Ian and Davin from Augmedix. Why don't I have you guys give a little bit about your background and just speak to your role at the company. Ian, if you want to go first.
Hey, thanks, Bill. Great to be here. So I'm the founder of this innovative solution, Augmedix. Started this all off about 9 years ago. We kicked off with a mission to rehumanize the doctor-patient interaction, and we'll get more into those details shortly.
Hi, I'm Davin Lundquist. I'm a practicing family physician as part of a large health system, Common Spirit in Southern California. I've been an Augmedix user for 7+ years, and about a year and a half ago, I became their Chief Medical Officer. Really happy to be here.
Okay, great. So before we dive in, let me do a quick commercial, if you will, for Medical Advantage for those who may be new to us. We are a part of the Doctors Company, or we fit under the umbrella of the TDC Group. The Doctors Company, many of you probably have heard of, it's the largest physician-owned medical malpractice insurer in the country. We currently insure roughly 100,000 physicians nationwide with over $6 billion in assets. The TDC Group consists of different subsidiaries or business units. Medical Advantage is the only subsidiary that is not in the professional liability space. We provide consulting and other services for medical practices for specialties at the point of care. If we go to the next slide, a quick summary of our services. On the left-hand side are portfolio of services available to help a practice transform and improve. These are typically related to clinical improvement as well as financial performance. On the right-hand side, we get into some of our EHR services or the proper use of technology at the point of care, which kind of segues into what we're talking about here today. If we look at this slide with just a listing of what it is we're typically doing for a practice. So I'm the marketing leader here at Medical Advantage, and if we look at our typical go-to-market, if we look at the engagement we get with early prospects, so people going to the web, searching for whatever it is they're searching for, landing on our website, making a request for help, we might get one a day or several each week. Easily half of those requests are somehow related to EHR support. It might even be as high as 2/3 during some periods of time. So there's a lot of struggle out. I don't have to say that to our audience. I'm guessing if many of you, the fact that you're here, you're probably very interested to learn more. But there's a lot of struggle and challenge in this area. We find many practices have an EHR implementation that frankly was not set up correctly in the first place, or we see a lot of tension and drama around the templates that are not optimized or maybe not streamlined for the specific types of visits that are common to the particular practice or specialty, so it causes just a lot of extra work for the staff. Then you've got issues with staff turnover. So we had our training 2 years ago, but the staff we have here today largely it's all new people, and they don't have the benefit of that training, and maybe the documentation is out of date. So lots of this can be a source of frustration for many staff members as well as physicians. And really, even a very well optimized EHR system can still represent a lot of out of hours work or evening time for members of the staff or the provider. So this is where I think we're all very excited with this relationship with Augmedix, and just the opportunity for the Augmedix solution to change the world. So with that, why don't we start to get into it? Ian, maybe you can give your perspective. It was the best of intentions as we move from paper to electronic, but many other things start to happen.
Yeah, I mean, I take no issue with the fact that we as a nation decided to go digital over the last couple of decades, and not soon enough, and for all the right reasons, and there's no going back to paper records and the way we used to do things. But along with every good decision, there's unintended consequences. In the case of going digital and moving to the electronic medical record, there's some very heavy consequences for doctors and patients across the nation. Next slide here. We as patients, if we go out and see our doctors, we can see it ourselves. They're hardly looking at us. It's hard to get time with them. They're running off. As soon as we walk into the room, they're distracted. And thinking about them as doctors, they hate it even more than we do. They did not go to medical school to be chained to the computer, typing away, feeding the beast hours every day on the computer. This is really a tragedy on so many levels, for the patient experience, for the doctors and their livelihood, and for doctor groups and health systems and their productivity and scalability. And that's really the pain point we at Augmedix were founded to address. We want to take a sledgehammer to this problem and utterly solve it, and I believe we have. And so here to tell you about what we do. Basically, we give doctors technology at the point of care. So if you look at the first column on this graphic, you'll see there's a little device on that table. And what it's doing is it's sensing the conversation between the doctor and the patient. It's reading the audio and video of that organic interaction. And it allows the doctor to just be themselves, engage as we're here engaging today, like they always wish they could have done. What's actually happening, however, with Augmedix is shown in column 2. We're live streaming from that device to what we call a tech-enabled remote scribe, quite literally another human being, a guardian angel of sorts. They're seeing and hearing what the doctor is seeing and hearing, and they're parsing that conversation and structuring that conversation into a perfect medical note, right in the EMR where it belongs, and they're doing it better and faster than what the doctor would do on their own. And crucially, they're operating within what we call a scribe cockpit. And it's got a bunch of tools and automation technology in it to really supercharge the scribe. So they're not just winging it, texting as fast as they can, typing away. They're clicking natural language processing expanders, which are getting smarter. They're invoking speech recognition modules, which are making software attempts at the note. They're, of course, cleaning and proofing those attempts. And they're just creating the note all together and making sure what arrives to the doctor is of superb quality. And the last column shows the resulting product. There's a note in the EMR ready for sign-off. All the doctor has to do is click confirm, perhaps make an edit or two, on to the next. So by using Augmedix in the flow you see here, we generally speaking save a doctor 2 to 3 hours a day. Shocking but true. We make the doctor really happy, really retained. We produce notes that are better in every respect, concluded faster, better quality notes, better revenue associated with those notes. Let's go on to the next slide. Just kind of wrap it up here. We really offer 2 lines of service. Augmedix Live is our real-time service shown on the left here. To bring that to tangibility, what that means is your notes are created literally as the day progresses. In real time is when your notes are arriving in the EMR. And furthermore, because we're live, real-time interactive, we can provide additional interactive services. So smart orders, smart referrals, Q&A with us. We can remind you of HCCs and other quality issues if you want us to. Our other service line, we call it Augmedix Notes. That service is our asynchronous, flexible note delivery service. Your notes arrive the next day in the morning. We can also modify that SLA if you need to. Because it's a non-real-time service, we can't offer all the same interactivity. So taking a step back, when doctors are out there looking for a solution that can produce notes from ambient conversation, some of them may choose an in-person on-site scribe, literally a third person in the room, typing and charting and clicking. But as we all know, that's not very scalable. It's very expensive. It's taking up space. It's churn. It's COVID risk. It's really not a solution for many doctors. Augmedix Live is better in every regard and happens to be 20 to 40% more affordable. And then Augmedix Notes happens to be even half the cost of Augmedix Live. So we're really bringing these capabilities, the sort of ambient documentation solution, to a price point and a scalability point now for every doctor to embrace and to use. So with that, Bill, we can talk more about the clinical side of things.
Yeah, excellent, excellent. The other thing, Ian, I just want to pick up on a little bit here. We have clients that use scribes. We also have clients that will record audio and then have someone, worry about transcribing that after the fact, and that's fine. But the fact that it's not only an audio stream but also video, it probably allows that person to pick up on the nonverbal cues or other parts of that visit that perhaps you wouldn't have just from an audio recording.
Yeah, you bring up two good points. Sort of what is the solution space in general beyond Augmedix, and sort of the importance of video. A lot of people ask, hey, is the camera on? Indeed it is. And it's not a high resolution camera so we can see every little detail of what's going on. But what it really allows us to do is to know when the doctor in fact entered the room. The visit is beginning now, or that is in fact the patient we were expecting, or that was an affirmative head nod or a negative head nod, or the left elbow or right elbow. So the video allows us that context and allows the doctor to be more natural. We have a lot of doctors that choose to use this audio only, but most doctors choose to do video on. Of course, all patients are informed of the use of Augmedix on first visit. The MA or the front desk, hey, your doctor uses Augmedix. Here's how it works in plain English. Here's a laminated FAQ and the benefits. Any questions or concerns that comes off. And we're seeing that 98% of the time plus, patients are very accepting and very happy. That statistic is true, male, female, urban, rural, young, old, 98% acceptance. And then another thing you asked about was just sort of the alternatives. I admire in-person scribes where they can work and they can do some things that we can't do. And so if you can make it work, all the power to you. But for many doctors, it's just not a scalable solution, which is kind of where we fit. On our left flank, a lot of doctors use dictation transcription, and there's certain doctors that that's the right solution for. And the key players there tend to be like Nuance Dragon or Fluency from Immodal. A lot of people confuse Augmedix with dictation transcription. I just kind of want to clarify the distinction. Dictation really requires the doctor to spend a few minutes after every patient, word for wording entire sections of the note, typing with their tongue, or perhaps a couple hours at the end of the day doing their dictations. What's different about us is we do the note from the conversation that happened. So when you're done with that conversation with your patient, on to the next patient, or going home, but no time with the dictation. That's one of the key advantages of Augmedix. Maybe Davin, it'd be a great opportunity to hear your point of view on sort of patient reaction and such.
Yeah, I'd love to jump in. So, I've been using this service for many years, and 6 or 7 years ago when we first started, I think the concept of virtual or remote scribing was new, and a lot of patients didn't understand what that meant, and they were worried that their encounter might end up on YouTube or something crazy like that, which makes sense. And obviously in the last year plus, I think patients and providers have become much more comfortable with virtual, right? I mean, we've needed it. It's become a necessary part of keeping our patients healthy and staying connected. And so I think people realize that it's safe and it's okay, and that there is at least a portion of healthcare that can happen, across technology. And so I think in a lot of ways, Augmedix was ahead of their time in, connecting such a valuable sort of helper, right? Which is this scribe that's somewhere else that can listen and see what's happening in that interaction, and then kind of magically create content for us behind the scenes. I've had many different roles in the health system, and one of them was as a CMIO. And so, the reason I got into that line of work was the fact that these EMRs were, they weren't great, especially when they first came out. I mean, they weren't user friendly. They didn't always make sense. Stuff was not built with the physician workflow in mind, right? And so early on, we were spending a lot of time trying to optimize the system to make it easier for the doctor, and there were all kinds of technologies and solutions that came about that said, hey, we can make your life easier, right? And oftentimes it was just another gadget or widget for the doctor to interact with, right, to deal with. And so on top of learning the EMR, then you had to learn this new widget or gadget to try to make your life easier on the EMR. And it just became sort of technology overload, right? And our doctors became, what I like to call distracted drivers of your healthcare. And obviously, there's been a big push. We know it's not safe to be a distracted driver, and we don't want our doctors to be distracted either. I don't think our patients want us to be distracted as doctors. And so when, they see us, typing away at the computer, or, frustrated that we can't, make it work or find information or do what we need to do, they sense that, right? And they sense that we're not completely 100% attentive to them. And so what I noticed is with the introduction of Augmedix, despite the fact that there was a piece of hardware and technology, between at the time using Google Glass, and, now a lot of our, users have a smartphone, but that hardware quickly became sort of, invisible to the patient, because what happened was, because of that hardware and the connection to this added support behind the scenes, I'm now able to focus on my patient. I can look them in the eye. I can be focused on them. I'm not distracted, right? And it's been a life changer for me and for a lot of the physicians that I've worked with.
Absolutely. And we were talking offline. I'll just share this briefly. Member of my family, we were working our way through a medical issue, and we had regular check-ins with a physician, and we get in this routine every couple of weeks, and we're in the exam room together, and then suddenly one visit, there's a scribe in the room, delightful person, but boy, it was just different. It's just a very different dynamic in the room, and she happened to be a rather aggressive typer, so that was just another, it was fine, but it was a little off-putting. We were caught off guard for sure. So having a device just sitting on the counter, seamlessly, I can certainly see the value there. Another thing I want to mention is, or let's talk about a little bit, is the level of detail or involvement that your virtual scribes are doing in the practice EHR. So whether it's reminders, alerts, reminders in the EHR, or I want to talk a little bit about coding recommendations, if how that can come into play.
Yeah, I think again, I think we kind of view them as more than just a scribe, right? They're kind of
Right.
a virtual assistant, a co-pilot, if you will, in this journey, and so they have access to the same EMR that our clinicians are using, right? So they're seeing the chart, they're seeing the information about the patient. If there is additional content that's needed, by the provider for that interaction, for instance, sometimes it'll be a hospital follow-up. The patient was in the ER the night before, and so I'll ask them to pull in that information from that discharge summary. Sometimes there's an MRI report that I want them to pull up, and we'll go over the impression that way. And all of that content, the scribe can just put right in the note for me, right? Like I don't have to transcribe it or dictate it into the note, from those other documents. The scribe, my co-pilot will do that for me. So the other thing is, obviously, like some of our doctors are better at kind of verbalizing things, just saying, hey, can you go ahead and order my wellness panel of labs? And they'll tee up those orders, or they'll say, hey, place a referral, order this x-ray, and anything that the scribe has access to in the EMR that they're able to do for that doctor. And obviously for legal and compliance reasons, we know the doctor has to finalize all of that content, just like they have to finalize the note. They can't just submit the note that the scribe creates. We do expect for accuracy and for compliance for us as physicians to read it over, make sure it's accurate, make sure it's correct, and sign off on it like we would normally. But 99% of that content is ready to go, because that virtual remote assistant has heard it all, seen it all, and they're focused on that, right? Like I can be focused on the patient and like what's going on with them, like why are they there, what is the problem, as I'm thinking through my differential, right? Or thinking through what tests, or is there additional information that I need to gain clarity on this diagnosis or treatment. I can be focused on that, right? All of my thought process and energy is focused on that and the patient, because I know I have confidence that someone behind the scenes is capturing all the details. I think the other thing that people sort of, I mean, if you stop and think about it, you'd probably realize this, but when you transcribe as a provider or dictate, you have to use brain power, right, to translate that encounter into the verbiage that goes into the note, right? It is kind of like a translation, right? Because you're translating natural conversation, you're filtering out, when you talk about the patient's trip, or they just got back from Hawaii, hopefully, or whatever it is, right? That stuff doesn't go word for word verbatim into the note, and you're probably not going to summarize it necessarily either, right? So, there's a translation that happens, and so the fact that someone else is taking care of that, frees us up, frees all of our attention up to do what we need to do. And I think another thing that doesn't get talked about enough is the art of medicine, right? And I mean, I think with all the technology, we talk about automation and algorithms and logic and hitting all the details and checking all the boxes, right? But I think when you're sitting in front of a patient, sometimes it's the subtle, the nuance, a feeling that you have, or just the compassion or empathy that you need to show them as they talk about the struggles that they're going through, right? I don't see AI doing that just yet.
Yeah, exactly. And I could see, maybe Ian, you could talk to this over time, as a new physician or a practice begins to use the Augmedix solution. I would imagine over time it it becomes a much tighter relationship, or maybe day one you're just, you know, doing the notes for me. But as we go forward, and there's an awareness on both sides, you know, no two practices are alike. Every practice does things differently. But there's probably then an opportunity, like Davin says, to become that assistant, or almost like a member of the staff, with updating the chart, or, you know, placing orders, or whatever it might be.
You're hitting on something big there, Bill. In the company, we're actually trying to get away from even using the word scribe, because it really just doesn't even begin to cover all that our platform can do, based on our real-time presence and our humans in the loop solution. So yes, documentation, getting the notes done is the core, but you can use us for so many more things. You can almost think of us as sort of your wingman, your air traffic control in the room to get so many of those things done. We have around 1,000 doctors on the service today, over a dozen prestigious health systems like Sutter and Dignity, Adventist, and others using and loving us. We also have hundreds of independent small and mid-sized practice doctors using us. And we see similar patterns. Once you start growing with us over the years, you start using us for more strategic tasks. So, you know, we're trying to move towards value-based care. Can you please elegantly remind us of HCCs and other care gaps which we would like you to work out with us? Or can you start doing these sorts of smart orders for us, or these types of letters? And we can be so much more. We want to be so much more with our point of care solution and documentation as the starting point.
Oh, that's great. The other thing that just comes to mind is the given Medical Advantage and our parent company being in the medical malpractice space. If there is a adverse event and we are heading towards a potential lawsuit, step number one with the plaintiff's attorney tends to be a detailed look at the EHR and the patient record involved. And what we find is the EHR can be this shining shield of defense, or it can be the Achilles heel of the practice, you know, depending if there's updated documentation that's buttoned up and, you know, detailed and appropriate and, you know, very thoughtful and thorough. That's one scenario versus, you know, it's an annual well visit and I can see you just did a copy paste from my annual well visit 12 months ago. You know, that's not so great for the practice. So I could certainly see a great benefit in that area as well.
Yeah, I think what we've seen with most of our users is that their note quality improves, right? And I think, you know, part of it is just limitations of our memory, right? I mean, when you,
Sure.
You know, if you don't happen to be one of the rare doctors who can, you know, keep up with every note, you know, at the real time for every visit, and you have a few notes at the end of the day, or a lot of notes at the end of the day to catch up on, right? Like, it's just not realistic to think you're going to remember the same kind of detail as you would right during the visit when that patient's in front of you, right? And so knowing that you have another person that's listening and watching and capturing in real time exactly what's happening is very comforting. I think the other thing that's kind of related to this is you know, billing and coding. What happens is we know that you know, by the letter of the law, if you will, we can only code or bill for what's documented. Not necessarily does that, you know, equate to what we did, right? So we may do things as clinicians that we don't have time to document, or we get in a rush and we forget to document, or we don't document as thoroughly because, you know, we've got to hurry home to our kids' soccer game, right? So we're hurrying to get our notes done, right? And so when you have your note complete basically in real time with the visit, and someone else who's observing everything that you're doing, it's much easier and you feel much more confident submitting a code that's appropriate for the level of work that you actually did.
That's amazing. I hadn't thought of that, which then has amazing impacts downstream in the revenue cycle, right? It's probably fewer, because we manage health practices all the time with that, you know, too many denied claims or a partial payment with questions, because to your point, the code doesn't seem to quite align with the documentation, and practices can spend a lot of time churning through that, or just throwing up their hands and writing it off and, you know, going on to the next. So that's a fantastic benefit as well. Very good, very good.
Yeah, and I think what's exciting is, as we've alluded to, you know, our assistants, our virtual scribes, you know, they're in our native platform and software, right? So that solution is getting better and better and smarter with, as you kind of alluded to earlier, with time, right? And I mean, one of the reasons, you know, 8 years ago that I was so excited about Augmedix was their philosophy of saying, hey, we know that technology can have a positive impact in healthcare, but healthcare is complex, right? It's complicated. There's a lot of nuance. There's people's lives are at stake here, right? So it needs to really work well and be seamless and not have a lot of errors. And so early on, the technology was not the main thing, right? There was humans, you know, helping, and the technology was a way to enable this service. But it was clear that with time, the technology would evolve, right, and get better and better. And so that would allow for more and more support and service and more efficiency, and so that's what we're seeing, you know, as we saw earlier in the slides, you know, now in the live service, there's lots of other things we can offer. And so coding, we think, is also going to probably show up soon, right? The ability for that software to kind of help you and you know, guide you and make recommendations around what we think, you know, the documentation supports. Ultimately, it's always the physician's, you know, judgment, but we think that providing some insight into what you've done will be helpful going forward.
Excellent. You know, we could do this all day. We should probably start to move to the next phase here. Josh, why don't we put the slides back up? Let's talk about some results. Here's some quotes from some of your clients, Ian. If we can talk about this just more broadly in terms of, okay, what's the result of all this? Yeah.
The result is many hundreds of happy doctors. We've saved many marriages. I've received text messages of selfies with doctors and their families. You know, this is the first weekday I've had dinner with my family. It's still light outside. Many tears. It's just profound. And a typical, you know, a lot of CFOs may say, well, that's all really nice, but why do I care? Believe it or not, keeping doctors happy has a soft dollar impact that a CFO does care about. For one, burned out doctors produce poor documentation and are not good doctors. Two, they quit. And when you find another doctor to replace them, it can cost nearly $1 million all said and done, or they partial quit. So increasingly, CFOs are actually responsive to improving doctor satisfaction and experience, because there's really a dollar associated with it. And we're really running the numbers, and that's why we're seeing health systems buy and uptake. As I mentioned earlier, we're showing very consistently we're saving doctors 2 or 3 hours a day. And what a doctor does with that time really varies. In some cases, they'll see more patients per day. In other cases, they'll tilt it towards work-life balance. In other cases, they'll tilt it towards research tasks that they may have. And we as a company really help the doctor group parse through those decisions and operations and actually run the data to make sure that we're meeting the mark from an ROI perspective along the journey. We're also seeing results as it pertains to Revenue, RVUs, coding, this is something we carefully measure in tandem as a partnership with our customers. And we also measure, as I mentioned earlier, patient satisfaction and patient acceptance. Most patients vastly prefer when their doctors use Augmedix. They do not want to go back to that distracted driver doctor, and for good reasons. So yeah, really exciting results. We're growing left and right in almost every clinic-based specialty. I think we're counting 30, 40 clinic-based specialties. We're rocking and rolling in the emergency department, hospitalists. More recently, we've launched in the hospital. We're doing very well. Heck, we're even growing in the veterinary area. Just the last 60 days, we turned on our first emergency departments for dogs and cats, and it's growing really quickly. So we're really flexible. We work in a lot of different contexts.
Okay, fantastic. We have got a number of questions that have come in. I'll just say it again. If you haven't submitted your question and you're thinking of one, please by all means do so. I don't think we're going to be able to get through all of them here in this session, but as I said, I promise we'll follow up. Okay, let's take this first one. We're a 5-provider dermatology practice outside of Kansas City. Do you have dermatology clients? Maybe, Ian, I think you just kind of spoke to that. Maybe address dermatology, but just talk to specialties in general.
Yeah, for the most part, we work in any ambulatory context where the doctor and the patient are having an interaction that needs to be documented. We don't work well, we're inappropriately used when there's no conversation to be had, when the patient is under and the doctor needs documentation for other contexts. So the good news is the vast majority of clinic-based specialties we thrive in, various surgical specialties. It so happens that our top 3 specialties where we're most popular are in this order: primary care, then oncology, then orthopedics, and then there's just a long tail, and I think dermatology is in the top 10. Davin, any other qualifiers you would say as to what types of doctors would work and under what circumstances would they thrive?
Yeah, I think I did want to mention that it works really well with telehealth visits as well, so even during the pandemic, many of us had to work from home, and I could just bring my device home, and so I sort of had my Scribe in my pocket, wherever I went. So they're equally versed at capturing a telehealth visit or an in-person visit, and now in my office I do both throughout the day. I think we can accommodate really just about any specialty, right? And I think one of the thing that's great about our service is we're very flexible. We're sort of EHR agnostic, and I think we're specialty agnostic to some point, right? And so we can, for people who are more templated and they're kind of used to a templated workflow, we can quickly adopt that and put it in the EMR exactly the way you want it. If you're more of a conversational based provider, we thrive there as well. So we're very flexible, and I think really any specialty we can make it work.
Great point about telehealth. Didn't think of that. That's wonderful. Okay, next question, a bit of a zinger. Here we go. What happens if the connection is lost? Is there some kind of fail-safe or backup?
Yeah, so remember we offer 2 types of service: Augmedix Live, our real-time service, and Augmedix Notes, our non-real-time service. So for one, this is sort of a non-issue with the non-real-time service. The visit just gets uploaded whenever there's a connection. There's no connection to be dropped. But I believe the majority of our doctors are on the live real-time service. So we've advanced the technology a lot, and our uptime is 99.9% or something on that order. So it does not go down very much. But when it goes down, typically there'd be a Wi-Fi outage at the point of care, and the device would immediately alert the doctor, hey, you're disconnected from the Augmedix platform, be aware, so that doctor will have to do their own note-taking, their own memory. And when their services resume, they would have the option to either type their own note or quick dictate the catch-up experience to the scribe at some point throughout the day. So it's a really good question. It doesn't actually happen to be a top 5 or top 10 concern these days. 5 years ago it was. 5 years ago we were getting tickets all the time about Wi-Fi and outages, but we've really come a long way, and it's just no longer a top concern. I have, interestingly enough, even run into a few circumstances where the EMR went long, and we've actually been an advantage in those circumstances because our scribes continue to support and partial document for the doctor, even though their EMR is completely out, unfortunately. And then when their EMR comes back online, we will upload those EMR notes. So we can be a helpful tool in a lot of those circumstances. We have 24-hour support. We have people to help the moment you need anything. It's sort of white glove. So we're just constantly communicating, texting you. You can text us if there's just anything that comes up.
Very good, very good. Okay, I think we'll take one more. And this is a question about pricing. Let's see, we've used scribes over time. So in relation to, I'm trying to paraphrase here, in relation to the cost of a scribe, what is the cost of this solution? Can you talk to that?
Yeah, I mean, it's substantially more affordable. It's 20 to 40% more affordable. You know, the price of an in-person scribe varies by what metro region you're in the US. You know, minimum wages and all, it just varies greatly, but it tends to be a lot more affordable. There are many places in the US where you can't even get a scribe. You call the Scribe Company and you're like, I'll have 1 or 5 more, and they say, get on the wait list. And then the moment you get one, they may churn because the model many of these Scribe companies use is they use folks that are bound for med school. So they'll be with you for 6 to 9 months, and then boom, that person that you've been working with, they just go on, and that's a happy moment for them, but an operational crisis for you. So, you know, I mentioned some of the other advantages. We don't take up space. There's the tech enablement with our natural language processing engine and our ASR engine that supercharges the scribe. They're the additional services. It's more affordable. So we're both affordable and better in every regard.
Okay, very good. Let's go to the next slide. We list out contact information for Ian and Davin. We'd love to hear from you. So our contact information is there. And just as we wrap up here and before we sign off, one final point. As soon as we wrap up, you're gonna see a survey that pops up on your screen. Just a few simple questions, point and click. We would really appreciate your feedback. And if you've got any further questions you'd like to ask, you have the opportunity to do that. If you take just a minute and do that, we would greatly appreciate it. Okay, so with that wraps us up for today. First, Davin, Ian, again, I feel like we could do this all day. I really appreciate the two of you taking your time and sharing your insights. We do a lot of these things, but you guys really did a great job today. Thank you very much. And then to you, our audience, thank you very much for giving us some of your time. We hope you found this session interesting and useful, and we hope to see you at a session again in the future. So thanks a lot and enjoy the rest of your day.